So Kim, I'm glad you're on because one of the agenda items was to talk about, potentially leveraging Lend for to do some of the research that we're talking about. Obviously, it's probably too late to do any kind of project now, but maybe we could get organized and it's something we could do for next year, as a way to get some research in, or maybe Carrie, within the school some options for to leverage free student research to kind of look into some of the things that we're discussing. But that was our one of our agenda items for this time. And I know, Kim, you had said you talked to Mary Beth, so I don't know if you want to give us an update on that. And
Yes, I did talk to Mary Beth about the Lend students supporting, supporting the survey. I just gave her like global information because I wasn't sure where we were going to go exactly. But I mentioned to her that we are trying to seek some funding, but that we need others to kind of probably substantiate what comes out of that because it may not be enough to cover, for example, surveying the providers.
Mhm.
She jumped all over it because, as you know, the Lens students are often looking for research, and for many of them, this could be their dissertation. So it's a win-win.
Okay, so that's something that we can definitely maybe discuss, is because I mean, Lynn, I know where we left off last time was really just still trying to kind of narrow down what we wanted to look at, to help. And then I did get reminded as well that there is someone specific at DDS, and their main position is to work on the workforce development for DDS. So I was also thinking, as an idea, maybe that's someone we can invite to this to speak
Absolutely.
to some of the initiatives that they're working on in the state, and just let us know if there's a way that we could collaborate or work together. So I'm happy to follow up on that as an agenda item for maybe next month, or whenever they could be free.
Tara, do you have any update on the status of like how are we doing in terms of advocating for the feasibility dollars?
Um, for what,
For to do the, to do the study that we were talking about. I mean,
so for the autism needs assessment,
yeah,
um, I am working with DSS to
okay.
see if maybe we could leverage money follows the person funds
Huh.
um to use that for the statewide autism needs assessment, because that would allow us to look at long-term planning for the population in the state. So that's something that we're pursuing. So it wouldn't be a legislative ask per se,
Okay.
or something in the budget. But we may still be able to get that done through the MFP grant. I don't have any update, but I am working on that as a way to, I don't care how it gets done. I just want to try and get it done.
Yeah.
But that would be, a very feasible way to, to accomplish that. Again, that was going to be more the replication of the assert one that we did in Pennsylvania. We would get maybe some workforce information on that, like, if people were having a hard time accessing staff, and that kind of thing, but or professionals. I forget what questions would be related to that, but maybe that's something that we could look at in advance to, securing any funding for that. We could look at the questions that are in that survey currently that would address, kind of get to the workforce data. If you would want to see that, I can resend that information to everybody if.
Yeah, I think that'd be helpful.
Okay.
I'm interested in it's. I think it's interesting the MFP approach, and maybe it's just my my limited understanding of MFP is, from my perspective as a provider, is as a vehicle that, assists with getting our institutionalized patients, if you will, back out into the community. So it's interesting to see where there would be an intersect that would somehow allow us to do that. It's fascinating that if there is, maybe it's just
Yeah.
my.
We were told through some technical assistance that it may be a way to leverage some things. So mainly because we would be trying to collect data for long-term supports and planning.
Okay.
So, as we're trying to project for those services, which is the logic into why MFP may be an option. Obviously, I don't know that it will come through or be approved. It's just, like I said, I'm trying to explore every avenue I can to secure the, any funding that might be available so that we can get this done.
Okay, because I know when I spoke with Rep Exum, at least this was a little bit ago, and both you and I were not available at the last meeting, so it's been 2 months now.
Yeah.
I let her know that I thought we were seeking money for this feasibility study. So, just did we think that we were not did we think this was a faster avenue, maybe a less challenging one?
Maybe, again, I was, like I kind of went into it exploring every option, knowing that,
Understood. Yep.
some may get approved, some may not. So, if we don't have to go through the whole legislative process and we can do this through, a grant, that
Yeah.
might be easier.
Sure. Yep.
But I haven't seen anything come through legislatively that would support that, but we also haven't had any follow-up conversation with any of the legislators as ASDAC. So that's something that we can also pursue to kind of, I can try and continue to get an update on the MFP request. I don't know when I can try and get a target date on when we would find out about that to see if, but there is a deadline. I forget, do you know what the deadline is for presenting or raising bills?
Yeah, I don't have that schedule in front of me, but we're moving along pretty.
Yeah, so I would just need to check that to see if it's something that,
Yeah, that would be good, just so that we don't sort of get caught where one falls through, but we haven't pursued the other and we're left with nothing. And I'm going to be up at the Capitol on Friday because of the appropriations hearings, and also I can poke around just to try to gather information, because obviously something I'm always talking about when I'm there is autism. So okay, it will come up in conversation.
I know that there was some, and it was brought up again in, there was the IDD caucus this week. And I know it was brought up again. There is an interest in, some of the advocates at trying to find out how many people DDS is currently serving on the spectrum.
Okay.
So I did mention to them that, to DDS, that this would be, if we were able to do this survey, that would encompass DDS as well. Really, we want to do as many people as possible, so it would be statewide. So that's something that we could disseminate throughout DDS. So maybe that's, and I can send you, Len, the bill. I think that there was a proposed bill for that, but I can send you that bill number.
Okay, that'd be great.
Maybe that's something that could go more specifically to a statewide needs assessment instead of just DDS, because really what we need to know is planning. And Brian, I know you presented this week to the special ed, or was it last week to special ed, but showed the numbers of increased rates of kids in special education.
It was both. Hi, everybody.
Hi, Brian.
Not to put you on the spot, but I know that data was presented. So I mean,
This
we
week
need
and
to,
last week, yeah.
yeah. So I mean, knowing how many, I know you guys have some numbers on how many kids with autism, but you know, it would be good to know a little bit deeper of long-term needs that people are anticipating. And that's what we're hearing from, you know, the community at large.
Brian, are you able to share those numbers? It'd be interesting. I know I looked at many years ago when we were first starting our program, just trying to understand the universe. And I don't imagine that they are decreasing.
Yeah, yeah, I can show you, just pull up really quickly now. The slide is a little bit overwhelming, but if you just bear with me for a second. So autism prevalence rates are the second highest increase that we've had as far as individual disability categories across the state. If you look at a projection from 2008 to present, there's been an 155% increase in
Oh my
autism.
gracious.
And if you look at the last 10 years, it's I don't want to misquote, but I think it's like 60+% increase over time, over that time frame. So I'm just looking at presentations here.
Is that that number that metric reflects students in?
Mhm.
Okay. Okay. Wow.
Brian, is that from DDS data or is that the national data that they report on 8-year-olds?
These are students who are identified by their school districts as requiring special education.
Okay.
Yeah, so let's see if I
Due to
have
a diagnosis of autism?
with a primary disability category of autism.
Okay, gotcha.
Yeah, I'm not sure. Is Tara, am I able to share my screen real quick?
Yeah, let me make that an option. Go ahead. You should be able to now.
Okay, thank you.
Yeah, I keep it off because you never know who's going to join these public.
Yeah, that makes sense. Okay, so just, yeah, so you could see our prevalence rates in general have been on the rise since 2007-8, where, you know, that like 5 or 6 year period when SRBI first came out, and our guidelines around general education interventions, we were hovering steady 11.5%. And then from 2012 on, you can see pretty much the sharp increase all the way to over 17.3%, which is where we're at currently. Part of the explanation for this is because we have a declining general ed population and an increasing special education count. So there is, even if we didn't identify more kids, the percentages would increase because if you look at the K-12 student counts over time, where we continue to, and these projections will continue to go down, I believe, over like the next 20 years. So, or as far out as they can project those types of numbers. So this is the slide that I was talking about that's very busy. Let me just see if I can enlarge it a little bit or at least show. I have so many bars in the slideshow from current slide. Okay, I think I have to share a different screen. I'm gonna try to share screen 2. Are you seeing the large slide still or the multiple slides?
The large.
You are seeing the large one?
Yeah.
Okay, so if we look at, so these are our identification rates by disability category. So if you look at autism here, back in 2008-9, we had 4,000, almost 5,000 students identified. And then you can see year over year what the increase has been until our last, we have updated for 23-24, but up to 11.8%. So it was 151.3% increase over time if you factor from 2008 back to that original to present. And then in the last 10 years, it's been 62.5%. Now, the reason for that could be many. One could be that our planning and placement teams are better adept at identifying students as, you know, with a primary disability of autism. Others is that there are more, you know, obviously more students with the disability category than there had been previously. And so it's just interesting when you look at I said the second highest, you know, when looking at this, but it really is the highest. Learning disabilities, there are more kids, but so that the total numbers still don't, you know, are still, I guess you would say, the third highest here on this chart, but it's interesting to look at and think about.
Trying not to make this about your data, but this is actually, I think, really helpful. So does this reflect students who are placed out of the district?
Yeah, these are all students. So that this is LRE would be separate, but I do have slides on LRE also to show.
Because I
You're
imagine that,
interested.
or I wonder if, is that number also increasing?
Yeah, so if you're still seeing the large screen, I'm just going to flip through here. So
Yeah.
when we talk about environments for kids, autism is down here. So, you know, this is the students by disability category who spend a majority of their school day with non-disabled peers. Speech and language impairment is the highest level of integration for our kids, followed by learning disabilities, other health impairment. Autism, so less than 50% of students with autism spend 80% or more of their day with their non-disabled peers in the general education setting. Here's a nice, like an easier way to look at it. And you can see autism down here, students with intellectual disability, only 20% of students included 80% or more of the day. Now, your question about separate settings. So autism outplacement is at 11.16% of kids with autism are placed in facilities other than their neighborhood schools. Our highest percentage is emotional disability at 24.7%. And then this other category is sort of a catch-all because these are what we report federally. But, you know, we could break those out if we needed to. And then, you know, the lowest amount, you know, which makes sense for speech and language and LD. If that huge percentage of students are 80% and above, it leaves very few students, you know, for those more segregated. So we have like less than 1% here for students that have those issues that are being outplaced. So it disproportionately affects students with autism as far as their ability to be programmed and to access general education instruction.
That's helpful. Thank you.
You're welcome. Yeah, so Tara, back to you as far as, you know, I know I apologize, I came in a little bit late, but one of the things I think you're all aware that we're working on eligibility guidelines for autism. There's been a lot of questions about legislature, if there's an over-identification or inappropriate identification of students. And one of the recommendations that came out of the Special Education Task Force was for the State Department to develop or update or improve our eligibility worksheets. We had mixed feelings about that because really in law, it's a three-pronged test. Does the student have a disability? Does it adversely affect their education? The disability adversely affect? And does that child require specially designed instruction? So we know there are many students with autism that, for example, are on Section 504 plans because they do have a disability and it may impact their education, but it doesn't require specially designed instruction. So the worksheet that we're developing is designed to help planning and placement teams make those determinations. The concern is we don't want it overly restrictive where it's excluding students who should qualify. We also don't want to kind of open the floodgates and then every student, you know, qualifying and then have an inappropriate identification. So it's a challenge, but we do have a nice draft in place that the Risk Alliance has helped us facilitate that document. And we're excited to have this committee feedback on that doc. I know, Tara, I think you've attended a few of those meetings as well.
We did. Yep.
So, there's a lot going on, obviously, but
Yeah.
you know, a lot of the discussion have been on costs and rates and rate setting and the LRE, Lynn, like you mentioned, the placement of the students and ensuring that districts are doing everything that they can to provide in the neighborhood schools for kids.
And Brian, really what we were talking about is, you know, one of the goals that we had as a committee or, you know, as the council was to look at doing a statewide needs assessment for autism. And some of that was to look at, you know, what are the long-term supports, going like that are going to be needed for autism, as we're looking at, you know, potentially, you know, more waiver slots in the autism waiver or at DDS, and kind of where those services are going to be needed, what's going to be required. You know, not everybody needs, you know, a comprehensive type of support. Some people just need behavioral services and, you know, more low level, like, you know, obviously the autism waiver is capped at $50,000. The average spend is like the average, you know, utilization plan is around $24,000. So, you know, we're showing that there are people who are being successful with just a little bit of support. But as we're doing more long-term planning, you know, we wanted to do that. So we had better data, not just on the number of kids that are going to potentially need services, but also what are those service needs going to look like so that we could look at maybe allocating funding to those appropriate, you know, resources as we, you know, move forward.
Carrie has her hand up.
It needs, oh, sorry, Carrie.
I know, I just think just following Brian's presentation of those data and then what you've just shared, Tara, too, I think it raises the question for me of who are the folks who are not necessarily going to be captured in those data, because as you said, you know, there are kids who are adequately served under a 504 plan, and then there are kids who are going to do okay in so long as they're in this connected, social, insulated environment. But once they exit that, you know, this is the proverbial cliff, another one that we, you know, and who could still, though, benefit from services, and how do we get them connected, and how do we identify who they are, and how do we accurately survey the land to get a sense of what is needed by whom. You know, that's to me sort of the nuanced aspect of this sort of research that is going to prove the trickiest. So while I feel like these data are super important from, you know, the State Department of Education, I also think we ought to be looking at 504, and I don't know quite how we identify those who don't really necessarily need more than what that sort of protected environment naturally provides, but will need something in terms of social connection and, you know, skills related to everyday living and those sorts of things. So that to me is the biggest challenge here that I can see.
And part of when we did it in Pennsylvania, you know, it was very much for, you know, not just knowledge on, you know, what the overall needs were, but like, you know, really was that long-term planning. So it was not just limited to those in school. When they did it, they did a caregiver survey and an individual survey. And then, you know, obviously there's age on there to try and capture, you know, overall, and by town or county, you know, so we can get, I mean, again, it's only as good as the number of people that will fill it out, but the more,
Yeah.
you know, agencies and people that we have who are willing to disseminate the survey, you know, the more robust data we can potentially have.
So how did you capture those folks who weren't necessarily accessing services of any
There's a question on there about if you're currently receiving any funding or services. So there were questions on that survey. And like I said, I will resend that out to everybody so you can look at what was done in Pennsylvania. And the goal was to replicate that, but obviously the questions aren't going to be applicable, not all of them, to Connecticut. So we would have to, you know, make it applicable to Connecticut and the service array that we offer to see, you know, are you currently receiving special education or 504 or services through Caroline or what, you know, whatever it is, we can, you know, make those, build in those questions to drill down that data so we can capture that.
How do you target the folks with autism in the state of Connecticut? Like, how do you identify them?
We just did a dissemination in general. So like we did, well, in statewide.
Not specific to.
Not specific to one group. We did do one for targeted to the wait list in Pennsylvania where they did a survey specific to that. So we could do some planning for those who are on the wait list. But my goal would be to disseminate it statewide. Not just for those on the wait list, because what we know to be true is that not everybody is signing up to be on the wait list because of the numbers and the length of time, especially for the autism waiver.
Oh, great. I understand that. I guess I'm sorry if I'm like really slow to understand this, but the survey goes out to whom? The entire population of the state of Connecticut?
As many people as we can disseminate it to. So we did, so we could target the, you know, through DSS, and DDS, we can target the people that we know who are currently receiving services and supports. We could also leverage our relationship with the Department of Education, ask, you know, for, you know, anyone to disseminate it that way through schools, you know, mailing as many people as we can reach. BRS, right, Kim? I mean, all the state agencies we can leverage and ask them to, you know, we did mailing in Connecticut or in Pennsylvania, but we can also do it electronically.
So the target audience of the needs assessment is broad. It's not only students with autism, it's also
That's correct.
special ed leaders, directors, educators, parents.
When we did it in Pennsylvania, the survey itself was to be completed by individuals with autism or caregivers.
Okay. Yeah, I'm just thinking because we in the summer, and I'm not sure what the timeline is for you on this, but
well, we still have to secure funding.
yeah,
this is still my, like, you know,
it's still a hatch. It's still
Yeah.
like hatching phase.
Yes.
So in the summer, we distribute a post-secondary education survey to students who are 1 year past graduation too. That might be something that we could
That'd be
piggyback
interesting.
on, or, you know, we could identify which of those students have primary disability of autism and make that part of our process. That's something that we can work together on but that's I mean, that's a smaller population. We wouldn't hit any of the school age kids that way. I'm just trying to think out loud here. And then
That would get to Carrie's question maybe, or one, I think, which is once they leave that protective setting, right?
Yeah.
So maybe that would be some of those individuals. Is that part of what you're asking, Carrie?
Yeah, thank you, Lynn. I think there are just some folks that and Brian, those would target then the students who had the primary diagnosis of autism. So I guess what I worry about is who would primarily be served by the waiver well, not primarily, but at least in part be served by the waiver might be folks who got by in schools without a whole lot of services and support, and tend to be those that occupy this gray space that really miss out on all the things because they aren't part of or attached to or tethered to any organization or real service. They might be piecemealing little things together, but they are this population I worry really about because they don't belong to anyone. And I think they more well, I don't think we know, that they struggle to kind of find their space and their connections.
Yeah, we use CT SEDS to send out feedback on the autism worksheet. We actually pulled parent emails who had children or young adults with autism as primary, and we received I think over 300 back, which was pretty decent, but we sent out like maybe 4,000, you know, whatever the percentage is, you know, you get back, if you get 20% back, you're doing great. But I'm just thinking, like, we also have 504 in CT sets that we could pull as well if that's the primary disability category. But when we do that, a lot of parents are upset that they receive these emails. Like, how did you get this information? You know, and so we always want to go through our legal department to make sure we have the authority to do things like that. But they don't, a lot of people don't like things coming from the state.
Yeah, I
Mhm.
get that.
Tara,
Sorry, Carrie, your audio wasn't working there.
Oh, is it?
You're not paused, but I mean, you're not muted.
Tara, I have a question about when we look at this survey, will we be also asking questions about their current level of receipt of services compared to what services they feel they need? Because I have a feeling like going back to the population that Carrie is talking about, that population often needs just like a rounded off support, which may be less available. And they may not be accessing the autism waiver because they're fully competitively employed, for example, and but yet they still need some aspect of support. And I just want to make sure that we're getting at that as well, because Carrie said it very well. This is a gray zone of individuals who don't always get access to what they need.
And again, I think that that's something that we can, you know, look at as we're, you know, as the surveys being developed, because, you know, we would be looking to replicate something that's been in existence, that's been useful for long-term, you know, planning for services and supports, but we would absolutely have to make it valuable for Connecticut. So we would need whatever information, you know, that we need to drill down in order to do that planning. So if that's something, I mean, there are questions about that. So I just put the link in the chat again, so you can look. I don't remember, I'm sorry, Kim, I don't remember all of the, you know, exact questions. And, you know, when you look at the website, you can see that, how the data is drilled down, you know, for Pennsylvania. But that was the other thing that we, you know, wanted to include in the plan, was to have a data dashboard so that people could, you know, see the data, legislators could see the data and access the data after the survey is completed. That was, you know, part of the whole, you know, like as we're looking at cost and everything else, that was part of it. There is in that link too, if you go to the survey portion of it, you can see all of the questions in the survey. So you would be able to see what, you know, if you wanted to take a look at that, and you could see how they were asking that information.
Thank you for sharing that again. Yeah, that was that I imagine too with the data dashboard. Then you're going to be continuously collecting data over time. So even if our initial sweep didn't quite catch a broad enough audience, by the time you post the dashboard and make that public, we could do another sweep to get additional
I think
voices.
they did it 5 years later in Pennsylvania. So they
Okay.
had funding to do the initial one, and then they got additional funding to do another survey 5 years later. I don't know that the website would necessarily collect data. You know, that's something that we could discuss. It's more of a presentation of what was collected.
So it was an organized way to disseminate the information.
Well, and that's why I was kind of relying on the the researchers that, you know, already did it, and as a way to replicate it, because obviously they've done it multiple times now that they've, and the surveys translated into multiple languages, so that wouldn't be a barrier, and something that we can have for Connecticut too, so potentially, if it gets approved, if we can find a way to get it done.
And there are questions on here getting at what I was looking for, which is
Okay.
the discrepancy between what are you getting versus what you need.
What? Mm-hmm.
And Tara, I know that it's been a while since I looked at the survey, and I remember the informants being individuals and families and care providers. We've talked, I think, in the past about getting informants such as vendors as well. I'm wondering if the group is still supportive of that, of being able to design the survey in a way that it's individualized to Connecticut, but also opens the door to additional informants.
Yeah, I think that's one of the things that we were just discussing prior to this, was looking at providers, you know, and getting some. The dogs decided to bark, so sorry. Looking at surveying providers was one of the things that we were talking about, specific to, since this work, you know, this subcommittee was specifically interested in workforce and education and training. I think this subcommittee was what we were talking to, potentially leveraging Lend, to have some students do a research project to look at, you know, some of the workforce and education and training and that kind of thing. Again, you can look at it. I don't recall it, because I don't know that that was hot of a topic. And, you know, I mean, it's been a hot topic for a long time, but definitely, you know, the last several years. I think the last one in Pennsylvania was done in 2018, if I'm remembering correctly. So, you know, workforce was an issue, but I don't know that it was as much of a crisis as it is right now. So I don't know that it captured that kind of data. So that may be something, again, that we could do as a separate, potentially project with some local universities or the Lend students, you know, that they need projects and studies and research to do. That may be something that we could try to leverage that to do with them. So,
Okay.
and then also, I don't know if, and this is something I have for the larger group, but Kim, you mentioned funding too. The other option that for ASDEC that we could look at is that I know some other councils have looked in, specifically the Rare Disease Council is in legislation this year, to be able to write for grants and have funding as part of their council. So that's something that if that's,
Yeah.
you know, if we want to do more of these types of projects, that's something that maybe the larger council as a whole would want to look into, requesting that we could be able to write for grants. And, you know, I mean, we would obviously need people to take the lead on that kind of thing, but be able to have funding attached to the council that would allow us to do some of that. I can send you guys the bill that the Rare Disease Council put forth. I think it was Senator Anwar that did that for them. So
That feels like a pretty simple fix and opportunity for us if we were to try to get that language in there.
I agree. I'm happy to reach out to, you know, I'm thinking about academic potential partners, and I'm sure Carrie, you might be too, but I'm thinking about like University of St. Joe's, which, you know, has a Jenga school, so they see a lot of, you know, children with autism, and they have several programs that prepare people for the workforce. So we may be speaking with them, and then I know our director of clinical services for autism, who is a PhD psychologist, Dr. Herlihy, also teaches at UConn, the PhD students. And so I don't know. I think just casting a broad net, maybe at least gauging interest, even though we don't have the means to move forward yet. I think because if we wait till we have the means, it's right, we just sort of prolong the process. So, I mean, maybe time spent that we don't get to execute, but at least it tees us up.
Yeah, and I think if we can still continue our conversations to drill down what information specifically we would find valuable to the council to continue, targeting workforce and, education and training that we would like to see as well. I mean, I think that would help to see if there is interest. I think the more we can articulate what we're looking for, the better.
Yeah, I don't want to, what I should be advocating for my own university. But we don't have money necessarily to support this sort of thing. And we have our doctoral programs are limited to, I mean, the only ones that would be perhaps relevant would be educational leadership and or counselor education and supervision, but kind of tangentially so. So, I mean, it seems to me that the USAID being connected to UConn, I mean, the USAID gets federal dollars to support individuals with
That's why
developmental.
they were good, logical first thought.
It seems to me, I mean, right? And you have, per your report, Kim, they're most likely are going to be eager doctoral students looking for research, and they have the funding to support, their research kind of thing too. And so it's kind of to me, it seems like a optimal choice.
Yeah,
perhaps.
I mean, because they're getting funding for their LEND project, and those LEND students are getting reimbursed for, participating in that program. So, and they have to do a project every year.
It seems like that might be a really worthwhile pursuit, is what I would say.
Yeah.
And I'm glad to hear that Mary Beth was very eager to receive your call and say, yeah, that's great.
So I think, as I know we're getting to the end, and Lynn, I don't know if you want, what you want to do for next steps, but I think as we continue to have this conversation, that we can maybe drill down and look to articulate specifically what we're looking for. We can put that to Mary Beth, and then that way, when Lynn starts up next year, we would have, is anyone interested in pursuing this? ASDAC is looking for someone to partner with to get this information. It's going to be relevant next year. The workforce, is
it's not going to go away.
Not going anywhere right now. So,
well, I think since you reshared the link and it seems like maybe all of us should take another look at the survey and see what's not relevant to Connecticut and what we think might be missing as a first step, right? At least, does that make sense to folks?
Yeah, and I mean, I still see this as two different things too. Like one, I mean, the larger, statewide needs assessment we're pursuing for
versus the
long-term supports and planning versus the workforce and surveying providers, seeing what, I mean, we heard from a lot of providers that, I know in the IDD caucus, I was there for that. And I know that, in appropriations, they heard, in human services, they heard from a lot of families. And, the biggest thing that we're hearing is rates of reimbursement, which comes to funding and being able to adequately pay people so they don't have to work multiple jobs in order to, do the work. It seems like there's a lot of people who are, value the position and the work that they do, but have to end up leaving because of inadequate pay. That's what was being shared. And then, just the amount of turnover as a result of that too was a common theme at the IDD caucus.
I wonder too.
Go ahead, Carrie.
No, I'm sorry, Lynn. I wonder too if issues related to equity came up as it relates to people being to pay privately for providers versus those who, can only access providers who either take insurance or Husky, or was that a point that I know that sort of been touched upon in the larger
Yeah,
committee?
not necessarily at IDD Day, because most of those,
Oh, right, right.
most of those
Yeah.
people were funded through DDS.
Yeah, got it.
So it wasn't an insurance,
Yeah,
you know, versus
Yeah.
private versus public issue,
Yeah.
but, you know, and I know that what I'm also hearing is, personally, I've heard from families and in some conversations that I've had with legislators, they're hearing from families that they want something that's equitable for autism, like what they have at DDS. So they feel that what the services that array that are being offered in the autism waiver are not up to par as what people are getting in DDS supports and services. So I did hear that for as an equitable issue, but to your point about insurance first, I have not heard anything personally on that or that during that caucus.
Thank you. I was just, I guess, thinking back to one of our recent meetings of the larger council wherein, you know, a couple of the providers who were on there had commented about, you know, not basically having challenges with insurance companies and taking a hit, or folks speaking to the need to only take private pay clients because they just can't navigate the changes in the insurance system and so forth. So that really is very limiting in terms of, you know, who can access services when there is already a limited number of folks providing. So
Yeah.
And have you heard, Tara, about the appetite to modify the insurance law for BCBA support?
That is still in TCB. It's one of TCB's recommendations. So it is, to my knowledge, still being the intention is still to draft language to support that. I believe as Representative Exum said, it
Yes.
was through 26 is what the ask was
Yes.
going to be.
Yes.
So that is the latest update that I have, but I have not seen language come out. Specifically, there's just a placeholder bill right now for TCB recommendations as far as last I saw.
Thank you, Tara. And, you know, if, I know you've been really good at helping us to keep on top of the legislation, but I think what might also be helpful is if we, understood like what would be a good help from our committee to sort of speed along some of these conversations. For example, a well-placed letter, going to a hearing, et cetera.
Yeah, the other thing I is as soon as I see any public hearing information that's related to anything, I will let you guys know. Based on you know, special education. I think I have in my bill tracking for ASDEC, I have all the special education bills, and then you know, there's several that have been like placeholder bills for autism, but I haven't seen more specific language come out. So as soon as I know or see any of that, I will let you guys know. The only thing that did come out this week that I'm not sure if anyone saw was from the Office of the Child Advocate, who released language about oversight for BCBAs and additional regulatory background checks and all of that. So I personally have some thoughts and opinions on that, but I will bring everybody's, you know, attention to that. And that was, I as far as workforce is concerned, I think that it could potentially impact, you know, we're already have a year-long wait list for some people to get services after a diagnosis. So, you know, if we're potentially regulating or limiting BCBAs in the state of Connecticut, that could be
Hindrance, so.
it could cause some unintended consequences for that. So that may be something that, we, you guys would want to take a closer look at to see, and in my email, I can send that bill reference as well. I believe I'm blanking, 7049, 70 something. But, I'll send that too. And, so you guys.
Did that grow out of some of these, was that, I saw a concern, I don't get too many of the emails, but I get them jumbled sometimes, but there was a lot of concern related to these ABA centers that have sprung up, and where there's some question about practice and oversight in those centers. I wonder if this is somehow connected.
It is.
Okay.
So it came as a result of the Office of the Child Advocate's report on, and the findings of that report,
Correct.
That there were children who were spending long hours during the summer months in some of those ABA programs. But the language that is put out currently is now applicable to all BCBAs,
Okay.
not just the specific to a setting. So
Okay.
that was something that I was taking a closer look at personally, just to, because my concern is, we don't want to do anything that inhibits people coming into or continuing to get licensed as a BCBA in the state, as we know that there's wait lists for services. So that's a concern. Yes, Kim, I'll give you a link to the OCA report and the bill.
Other thoughts before we close? A small but engaged group. Thank you.
Yeah, and then Lynn, I just, as a follow-up, did you want me to reach out to DDS to see about their person who's addressing workforce?
Yes, that would be great. I think it would
Okay.
be great to have them come. Absolutely.
Okay, then I will see.
If we can hitch our, if we can learn from that, I think would be very helpful. I'm sure there's a lot of overlap.
Okay, I will see what I can do on that.
Okay, excellent. Thank you all.
All right, see ya.
Thank you.
Bye-bye.
Thank you. Bye-bye.